Hi, Lewis here, tutor for Level 4. Just going to take you through a little guide to the assessment part of the reflective report about caring for somebody who's got complex needs. If you've jumped in on this one first, you probably need to go and do the first guide and the workbook stage first, because that's going to develop your knowledge and get you ready to be able to fill in the assessment part. And really, if you try and do the reflective assessment first without the workbook, it's going to make it quite a difficult thing to do. So, those of you who've done the workbook and you've got that sorted, we're going to go through this, which is the complex care reflective report for Mrs. S that you'll hand in for marking afterwards. So it's worth 20 marks, and it's got the same sort of structure that you will have seen in the workbook. There's an introduction, an assessment section, planning and review, with a little comment of conclusion. So we're looking at the care process, particularly the assessment, planning and review sort of cycle of care that nurses coordinate and that you work alongside. We're also looking at wellness and how do we achieve wellness for somebody that's very, very sick. And we're also looking at some strategies for strength-based approaches with patients. So those two things are going to be woven into the assessment, planning and review. So look, let's go through this, and it's available on Moodle once you've done the workbook, and we're just going to have a little bit of an overview of what the different parts of it have. So the first thing I want you to do in the introduction is really to show me that you've understood what complex health care needs are. So why do we call this complex care? Mrs. S has got a particular mix of things going on. She's already had something that is not curable in the dementia, and that's got challenges particular to that condition. And she's got another short-term illness come in as well. And I want you to sort of explain the two parts of that and just show me what's going on and why we call it complex care. So a short paragraph on that would be great. The next section is assessment. Here I want you to describe each of her two conditions and use the knowledge about her symptoms for each condition. So I want you to give me a sort of a fairly thorough, specific explanation as to what's going on from the scenario. So look back at that. Look back at chapter 12 in the Angela Granger book, and also look at those little video clips. All of that will inform how you explain what's going on in both of these conditions that Mrs. S has got. So that's the assessment part. In the planning part, we're going to apply the wellness model a little bit into our planning. So two things at once here. So you need to perhaps go back and look at that Te Whare Tapawhā model that's listed on page 11 in the workbook, and just think, what is the wellness that we're trying to achieve for her? We can't get her perfectly healthy and well. What are we trying to do in regards to help her? So we're supporting planning of wellness for Mrs. S, and we're thinking about that from a Te Whare Tapawhā holistic perspective. So I want you to sort of think about the model and apply some of those concepts to some realistic picture of wellness for her. What are we aiming to try and what are the sort of picture of health? What are the things that we can make some difference for and change in getting her to be as well as possible? So give me a couple of sentences or a sort of a half a page paragraph on that. Now in 3.2, we're going to get a bit more specific. We're going to select only one of these two things below, and I want you to demonstrate how you would apply some wellness thinking or concepts of wellness strategy in your care delivery for just one of these needs. So either the first option is that Mrs. S tells the carer to leave her alone. She's refusing to allow the HCA to do her normal hygiene cares, and she wants to stay in bed and is snappy and irritable. Or choose this option. Mrs. S is very unwell. She's hallucinating and calling for her dead husband to help her. So these have come out of the story, the scenario, and I want you to choose one of them and show some practical support that the caregiver could provide to make a real difference in supporting this challenge, just one of those challenges for Mrs. S. So again, pull it apart, explain what's going on, and show how you would use different strategies to help this. And again, I want you to be thinking of it from a wellness perspective. Maybe there's different strategies that have different aspects of Te Whare Tapawhā that may have some keys for making a difference for this particular need that you're planning for. So that should be about a half a page. And then the last section is the review. And this one, I want you to go back to the list of strength-based approaches. And the first thing I want you to do is just to describe briefly what these concepts of applying a strength-based approach is designed to do, in the way that they work with the patient. What are they achieving? If you were to sort of sum up and give a description, how would you describe the benefit of thinking in a strength-based approach? So a short couple of sentences on that, and then we're going to apply two of these that I've taken from that list back in page 12 of your workbook, and I want you to think about, or to review, to think about Mrs. S's care and her situation, and for both of these, I want you to describe why using this strategy could make your care more effective. So both of those have a way of working with a person. The first one is called systematic assessment of strengths. And here you look, the deficits and problems are recognized, but instead of this being the focus, you shift to assessing and looking for the individual's strengths, resources, and interests. The emphasis is on what works and what is available to support their success. So think about that, and then think about how you could apply that to the way you worked with Mrs. S. The second strategy is called a relationship that is hope orientating. One of the many good qualities of a strength-based approach is that it seeks to establish a positive, accepting, and encouraging relationship with others. This kind of relationship that is based off encouragement, building potential and hope that increases the individual's view of their own available strengths and resources. And this creates more opportunities and options. So again, think about that and think how doing that would make a difference for Mrs. S. Maybe you could describe the way that you might do that, and maybe some examples or situations where you think you could make that or act that a strategy out in the way you cared for Mrs. S. And then the last thing is really just a personal learning statement. I want you to do a couple of sentences that just finishes with a review statement about what you've learned personally from doing this report study. And that should really only be a couple of sentences. The last thing on this is the measuring, the marking rubric, and just take a look at that and see where the marks are allocated, and that will just give you a little bit of a heads up as to where the marks are available and the sort of things that we're looking at for this assessment. If you have any questions about it, please get an email to me, and I'll answer and give you a little bit of feedback or guidance, hopefully, as to which way to go with whatever it is you're working on within this assessment. Thank you.